All right, so how common are pelvic floor dysfunctions? As you can see, I just dropped in a couple of different points here for you guys. None of them make sense because I personally, this is my personal statement. This is Sneha Gazi's statement. I think that all of the studies are underreporting because these are hard things to talk about. It is very easy to sign people up for studies and get people in to talk about cervicalgia and, you know, concussions and ankle sprains. And I think it's really hard for people to talk about peeing themselves. So I think that a lot of the literature is skewed. I think it's also a culturally skewed presentation as well, because there are some cultures that do not talk about this stuff. So in those areas, this might be really understudied, whereas certain cultures, you might be more freely or more able to talk about bowel, bladder, and sexual function. So it might be easier for people to have those conversations and be able to do this work. So that's just my take on it. But here's some of the information that I found for you guys online. So the literature shows that 1 in 4 US women report moderate to severe urinary incontinence, pelvic organ prolapse, and fecal incontinence. That's huge. I don't know how true that one is. I'm not sure because these are all just studies that have, you know, everything is for after 2016, 2015. So all the studies that I've pulled into the presentation are less than 5 years old, but that's huge. So think of the number of people who you've treated who identify as female or have female anatomy, right? So they have experienced this or will experience this at some point in their life. By age 80, the number of women that will have 1 or more surgery for urinary incontinence or pelvic organ prolapse. These surgeries are basically slings that kind of provide more support. There's also a mesh surgery that's illegal in other countries that I believe still has happened in the United States for a considerable amount of time. And one study said 11%, another study said 20%. So we don't know. 40% of women experience sexual dysfunction. I think that this is also huge, 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 huge number, but I think it's probably more, most likely. A lifetime prevalence of, you know, approximately 1/4 for sexual pain disorders. Men identifying with pelvic floor dysfunction, 16% there. It says 30% of all women will experience pelvic organ prolapse in their lifetime. I think the study might have also been skewed to childbearing women as well. 26% of women between 30 to 59 years old experience stress urinary incontinence. That's also a lot. 30 to 50, pelvic organ prolapse. 27, constipation. You guys can see like these numbers are kind of going like side to side to side to side. And I think there's a reason for that. Of course, it's the way that the study has been conducted. Partially, I think, has to do with cultural implications and comfort levels of people actually reporting things appropriately. So the point of the slide is you've probably treated somebody who has pelvic floor dysfunction or of some kind. I also have been in several situations where I have friends who are in healthcare of some kind, who are doing something completely outside of pelvic health, who have told me, hey, I need to ask you a question about this, this, and this symptom. Is this pelvic floor dysfunction? And I will say yes, and they will be able to make the correct referral. And I'm happy. And those people know I'm a pelvic floor physical therapist, so they're able to ask me. But it's possible that you might be having a patient with shoulder pathology who also has urinary incontinence, or you might be experiencing an elderly man who has fallen and you're treating him for gait and balance, who also is post-prostatectomy, who has urinary incontinence or nocturia, urinating at night frequently, and is having that problem, but it's not diagnosed and it's not being treated. So I just want everyone to be aware that this is out there. It's a lot, and we should just be mindful as clinicians and not kind of rush it under the rug because it's a sensitive topic. And we're going to kind of get to that, how to ask questions in a sec.